Dr. David Stoker, board-certified plastic surgeon in Los Angeles, showing you the results on a 46-year-old very fit male. We did abdominal etching to carve out a six-pack here. Okay, you can see the definition that we created using power-assisted liposuction, liposculpture. Also shaved down this area here, as well as the love handles in the back. It's what I would consider a spectacular result. You can see this front groove right here. I did through an access incision in here. This is an access incision now, approximately 4 or 5 months after surgery. Little access incision where I came across here to create this groove. Within this tattoo, which we're camouflaging somewhat, I have a little access incision that I hid right here to create this groove. There's a little access incision over here to create this groove. And then through the belly button and a little one down here, I was able to shave this down. It really makes the most out of what he's got. Even in the crowd at the gym that he works out with, I know he says that they are shocked how good he looks and wonder what his secret is to getting these abs. As far as I know, he has not yet handed out my business cards at the gym. I think he's keeping it a secret. For the flanks here, he's got a great, he used to have a little bit extra here despite his fitness because he's in his 40s now. One little access incision here, which is easily concealed by the normal position of the underwear. I was able to take out all of this area here. So that's fantastic. We're toying with the idea of maybe doing even a more intense sculpting on him now. Not sure we're going to do that or not, but one thing we are going to do, if you just lower your arms a little bit for me here, he's got some prominence in here in the chest, what we call gynecomastia. It's a little bit excessive. And I don't want to show you the upper body because he has identifiable tattoos. But basically, I'm through the same access incision, I'm going to shave down this prominence in here. And I'm going to really sculpt out the serratus anterior muscles in here. So his pec will be more defined. The serratus will be more defined on both these sides here and give him a more fit, sculpted look. He's already pretty darn fit, really as much as anybody could expect to be at age 46, but he's not 16 or 26 anymore, so it's a little bit different. There may be a little breast tissue in here, in which case I'll make a tiny little incision and excise that at the time of the liposuction if I feel that that will improve the overall shape with him. I can do the chest under local anesthesia, just as I can do the abdomen here under local anesthesia. Usually if I start getting more involved, more areas will then involve the anesthesiologist, which I probably do in the majority of cases, but when somebody comes in with an isolated issue like this, we can knock it out with just local anesthesia, which I think is going to be our plan for him in a couple weeks. But anyway, I'm really pleased with these results so far. He's making me look good by continuing to be fit and make the most of this result, but that synergistic effect of me helping somebody to take it to the next level tends to inspire patients to stick with it and make the most out of themselves with diet and exercise. And at the end of the day, the patient is the one who wins the most, and we're all really happy about it.